Hey, I want to welcome everybody to Her Health Unveiled. And this is our finale episode. We've done five. This will be number six. And we are bringing on Shara Lews-Campbell, all the way in London, England. And she has been so influential in bringing to the stage a lot of conversation that we don't typically have, specifically about women's health and women of color throughout, not just today, but even decades past, and what we are experiencing along those lines. So, Shara, you like to introduce yourself?
Yes, I'm Shara Lews-Campbell. I am the founder and owner of Re-Ink Publishing. That's me really in a nutshell. And obviously, I've had some health experiences, and behind the scenes, I have other interests which have involved healthcare within my profession. And before I even got involved, I don't know. Before I got involved, I was always writing, so I've been writing a very long time, and publishing, etc. But I've always had a connection with healthcare within the industry. And I thought I'd amassed around 10 years, but when I thought about it, it's actually almost another 10 on top of that. So pleased to be here at this series.
Well, we want to reflect on these episodes, and we want to reflect on what we've learned. We want to share the voices that impacted us the most during this series and give our listeners a glimpse into what's coming next between ourselves. We've been working on some mutual projects, and we're going to talk about that a little bit. We'll talk about our upcoming series on First Light. But first, I want to ask you personally, because a lot of times you shared a lot of personal information. And in looking back on this series, what stands out most for you?
I think quite a few things that stand out for me. One is how far we sort of come along in our healthcare, but how much with the basics, in healthcare hasn't changed, so we seem to have sort of in one breath, we are, very advanced in technology and, AI and healthcare as a whole. But in another sense, and this is like on the day-to-day sort of patient care level, it still leaves a lot to be desired. So, we've come on leaps and bounds in one sense, and then we haven't, in fact, it's got marginally worse, I would say, or things have stood still in terms of patient care and the access to treatment, especially for Black women. There seems to be very little improvement, if any, I would say, since I first became involved in healthcare. So I think there's a lot to sort of be desired there. I think also other things that have stood out to me is how brave I have been, in being so vocal and open, about my own experiences in healthcare. And that hasn't been easy, I mean, this is information that I've sat with all my life, and I never thought that I would be having these conversations with you behind the scenes, Grant, that would then sort of lead to this. So I'm pleased that I've done it. Probably others may not think so. But I think that if we don't, we can't get the knowledge out there. So and that has to start from within. So it's very important that I sort of speak about what I've been through and what I've experienced, so that it can spark this ignition that we need for other people who are from the same sort of culture as me to also do their share in sort of creating better healthcare for people that will come after us, the younger females, that will have to go and utilize this system at some point.
I hear exactly what you're saying. I know I learned a great deal in talking to you. A lot of things I just was not aware of, and maybe I should have been aware of. And I think what you said earlier about finally you getting to the point of sharing your story, and maybe that's what we need to do more of, is that there is a disconnect, there is a gap, there's some dissonance here in healthcare system, not just in the local community or the national community, but internationally. And you say, why is that? What is happening? And I'd like to share just a couple of stats that I was just taking back on. Number one was 80% of maternal death among Black women are preventable, but not inevitable. Preventable. That's huge. And that tells us that the problem isn't women's bodies, it's the system that is failing them. And it's the same story when we look at conditions like fibroids or postpartum depression, or even how pain is treated in the delivery room. The inequities run deep, but the solutions are within our reach if we are willing to confront bias, we are willing to confront the funding deficit, and we're willing to confront and actually make a priority women of healthcare or women of color in healthcare as a study, and really take a look at this, because the facts should reveal, okay, maybe there is some issues here in the way that we're actually practicing healthcare worldwide when it comes to people that are largely different. So I want to ask you this, Shara, if it brought home for you some sense of urgency or advocacy, locally or globally or both, from your lens.
Yeah, definitely. I mean, it's something that in terms of better or improvement for better healthcare, especially for the diaspora, this is something that I feel very strongly about, and I very have those discussions very frequently, and talk about, what I know to be true. I mean, even when I think about, just some of the things that you were saying about what needs to change in terms of the standards of improving healthcare and better treatment all around. It starts really with mindset. I mean, when I even think about today, I've learned just today earlier that I've learned that even with the health hair care products that we use, and you wouldn't believe that this was even a topical issue, but it is. It's been found that 30% of the ingredients that are used in just like our hair care products have led to more mortality rates, maternal issues, and also cancer, can lead to these properties. When you compare it with products for white females, it was just 7%. So why does it have to be 37% for Black females, and only 7% for white females, and we're just talking about hair care products here, but these products are also affecting our health. Never mind patient care and the types of care that we've been discussing in this series. I think we just need a whole revamp and a change of mindset as to how we are viewing female Black women in this day and time. It's just absolutely absurd to me.
I'd like to ask you from the audience, because we've had feedback over the last month and a half, 2 months, from other people that have viewed the our episodes, and the feedback has been pretty stark. It's been overwhelmingly positive, as far as, I'm glad someone is speaking up, because, to what I was saying earlier, maybe in your own experience, it took you time to actually talk about these things. But if we don't talk about these things, they continue. I was just overwhelmed by the so many people having these types of experience. I want to get from you, from your audience. Did you get what I would say like this? What type of feedback did you get from your audience?
It was really supportive. I received lots of messages, or DMs, as you would call it, where people were saying that they were proud that I was speaking out, and that, especially when we did the one about the hysterectomy and, the maternal issues that lots of Black women face. There was what I recall one particular person explaining that this is sort of like becoming a commonplace thing within their own family, that there are lots of Black women within their family that were having problems, with maternal treatment, etc., or failure, lack of, and they were very much in a bind and not knowing, where to go or what to do, about their situation. And I think just by telling them to ask, the right questions, where have these studies come from? What options are available to me, and really sort of starting to take your own healthcare in hand. And I do feel that even though there is more of an emphasis about us being responsible for our own healthcare, that is the message that is coming from, the NHS here, that it has to be sort of a partnership. However, I don't feel that they say it with the right intentions. To me, when they say it's about them not taking responsibility or accountability, rather than working together with patients to actually get the right treatment and support that they may need. So I do feel, because I think if it was a genuine, then we would hear more about it. What are these options that are available to us? We're never told. We have to go away and do our own research, or turn to homeopathic methods. And I don't negate that, because I actually feel that that is a great option. It saved my life, and I think that probably would be the first port of call than relying on someone who's also relying on Google. I mean, they're not doing anything different, aren't they, really, when you think about it?
And I'm glad you said that. As I thought about it, especially that last episode we just did with Dr. Tanya, talking about clinical research and some of the things that go into that. And I really began to understand a little bit more. Some light came into my own understanding, is that a lot of the research that has been done over decades, and maybe over a century of time, was taken from a very small subset of individuals, in which practices were created, medications were created, and whole methodologies were created, and it was like one size fits all. One size fits all. And this is a problem when you start to think about, like, well, one size does not fit all. Like, I'm very, very comfortable eating seafood. I can eat seafood all day. But if you give that same, seafood to someone else, they could obviously it could affect their life, right? Right? Because they
That's
can be,
right.
or
Yeah.
adversely affected. There's other things that go on in human beings, that, if we don't take into account for these things, can have adverse effects, right? And
Mhm.
so when you take into account, that the limited research that has been done, and hopefully in an AI centric world now, that won't be as much, because we can get information quicker. This is how we were able to get vaccines for the COVID um, disease that was happening, because we were able to use these supercomputers to crunch a lot of data. So we should be able to use these same type of tools to start really looking at the entire population of humanity, and not just a subset. And maybe at the time that was all that was available, but it's no longer the case. So we can take a look at these things. If the numbers are telling us that, hey, when we apply these same methodologies, we get very, very bad outcomes. And we're starting to see very, very bad outcomes in people of color. That should tell you something, like, hey, maybe we need to tweak some of these medications. And these are facts. These are not mainly just, racial biases. They're just, sometimes it's just based on skin color, the density of skin color, the hue. There's different things. It just operates differently. And because of that, you get different metrics, you get different measurements. And because of that, it can lead to bad outcomes. I'm starting to see it in diabetic, diabetes. Even, hey, we're measuring your diabetes, yet we're giving you these medications, but we're not seeing the same results as we're getting in other subsets of people for the same medication. But in this population, it's not as good. But instead of developing something that could possibly help, it's just, either we try to lower the dose or raise the doses, and they're just playing with it. But the fact of the matter, it was not actually made with your type of makeup in mind. So hopefully things like precision medicine, like Dr. Tanya talked about, precision, in those aspects, can give us a better outcome. How did you feel when Dr. Tanya kind of shared a lot of that intel with you?
I thought it was our strongest episode, to be very honest with you. And I thought that it kind of very much solidified everything that I had been discussing with you throughout the previous weeks, about how little our voices are form part of these conversations, and that's in any part of healthcare, and we're entitled to have a voice, there. And when she talked about the clinical studies, I mean, we've still got a very, very long way to go with that. I mean, she sort of, hit the icing on the cake, put the icing on the cake, as it were. But when you think about it, we're only currently our voices are only between 4 to 7% of any clinical healthcare study. So, when you think about, when you say, well, one size fits all, that is still very much the case today. If something, and like you said, just going back to your point regarding the seafood is great for you. It isn't for me. That's not to say I don't eat it, because I absolutely love some of it. However, I know how very ill I can get once I do have it, because I'm actually allergic to it. And thankfully it's not a really bad reaction, but there is still one. I still have an allergy to it. And even today, I'm also allergic to penicillin. It's something that has been given to me in error, and I've seen how desperate I have become immediately after having it. And these days, I'm still having to convince surgeons when I speak to them why I cannot have it, and they are telling me that, it's come a long way since then and they still want to try it. I'm not here for that, because I know just 20 years ago, when it was administered to me, following my full hysterectomy, and they were aware that I was allergic to it, they gave it to me anyway, and I suffered severely, as a reaction. Had they not been able to find something to counteract that, I don't think I'd be here to tell the tale. It was that severe.
These are important things to really think about. And when I want people to think about this is not just what we call a racial discussion. You have to understand, when you're practicing medicine on human beings, you have to take into account the entire makeup of the human population. And I don't think a lot of people understand this. If most of our medicine, especially in the West, are created from a European society that only makes up 16% of the entire world population, 16% of the entire world population is European. 15% of that is sub-Saharan African. 15%, not a small number. The rest of that comes up. East Asian is 20%. South Asian is 25%. Vietnamese, Thailand, things like that is another 9%. Indigenous populations are 1%, and mixed race populations around 5%. So if a small subset of 16% of the people are making medications for almost 100% of the population, that's going to be a problem. Even if you cut off the eastern part of the world, say, okay, we'll cut that 50% out because they do their own thing over there. Well, still, in what we call the Western civilization, you are negating over half of the people when you're coming up with methodology. That is a problem. And I think what we're saying in this particular show is that has to change. There are adverse effects that happen that we are not accounting for, and either we're becoming complacent about, we're allowing it to be part of the status quo, and we're not really doing anything about it. Say, hey, we can't really afford to change these things. Well, what is a human life worth? We have to really think about that and think out ways to do things better for ourselves. And that was one of the other outcroppings I got of our discussions. What can we do to be accountable for ourselves? I think number one, you have to be aware of the situation. Like, okay, I got it. Some of these medications weren't made for me, weren't made for my makeup. What can I do about that? And then maybe we go back to some of our indigenous roots. You brought up something that actually healed you. And I want you to talk about that even more. There's traditional medicine, and then we would call non-traditional, but some of these non-traditional methods actually work.
That's right. I'm so grateful to it as well, and so grateful to my business partner as well, who is the person who told me to take it, advised it to me. Otherwise, again, I was suffering really badly with vertigo following a suspected stroke earlier in the year, and it had just turned my life upside down. I couldn't even do this. I remember sort of speaking to colleagues, and I had my hands in my head, and it was just my whole world was just spinning, for it was like about 2 months, and my world was just spinning around. Everything was just like making me very dizzy. And I was given, eventually, the doctor gave me they gave me some exercises to do, and you have to do them extremely quickly. And they advise you that once you do them, they're going to make you feel worse than you currently did. And so that I went through that for that as well. And the only um, medication that they have to stop vertigo is the one that I wasn't suffering with. So they don't have anything for what the condition that I had, which was vertigo, called BPPV. So that's what I was suffering with at the time. So when everything else failed, I mean, I couldn't even continue with the exercises because, well, I was frightened to do them because they made me so unwell. And, I was struggling with this and struggling with all my responsibilities. And, as I mentioned before, my daughter wasn't well as well. So trying to look after her as well during this time. And neither was my grandson. So there was a lot happening here. And, my business partner was so concerned that he sent me a list of homeopathic remedies that I could choose from, that would have been known to work, for this condition. And the only one of them that I had was the ginger root at home. And I tell you, I always make sure I have it now. And yeah, I don't suffer with it anymore. And it's just absolutely brilliant. It gave me my life back. Yeah, I'm really, really
Dang,
happy.
we can't negate nothing like that. So just because it's not popular or maybe it's not endorsed throughout. I mean, I remember a lot of things that came out of the Eastern world, just like acupuncture. People are like, oh no, well you can't even get health.
Mhm.
No, your health care won't pay for it. Your health insurance won't pay for it. Now everybody
Mhm.
knows that it actually is very beneficial. I remember in the chiropractic world, which now we take it for granted. It used to you couldn't even get any kind of health insurance to pay for that type of thing, but it gave a lot of relief to a
Mhm.
lot of different people. I think there's a lot
Mhm.
of things that are outside of what you call Western medicine that are actually very, very good that can help to alleviate issues and problems. But going back to our accountability that I brought up, we really got to look at what we're putting into our diet. Our diet is
Mhm.
huge. And because we've made
Yes.
it easier to get processed foods, but it's not nutrition. I always get back to a car. I have a car that takes premium gas. Now I can put regular
Mhm.
gasoline into it, but guess what? It will not run very, very well.
That's
And when
right.
you're putting processed foods into your diet constantly and you're not giving your body the nutrition that it absolutely needs to function at its highest levels, instead of eating things because they taste good, instead of eating things because they make you feel good, you got to start really taking some accountability around diet so that you can avoid
Yeah.
being in the
Mhm.
healthcare system. You try to avoid that. You want to get into preventive health, right? Which is very, very
That's right.
good to do. And I highly encourage people to find real good diets that fit their own physiology and eat things that actually are truly beneficial. You can read up on these things. You can find out about these things,
Yeah.
how they break down the enzyme use in your cellular makeup. So you don't have ongoing issues and problems. And I bring this up because me and you are working toward having a retreat in St.
Mhm.
Croix sometime
Yeah.
next year around women's
Mhm.
health, around technology, around precision agriculture, things of that nature that can try to alleviate some of these problems. We want to have high level discussions. So as we end here with her health unveiled, we want to go ahead and because you brought this to my attention, like Grant, how do we bring this retreat to St. Croix? So we're talking about that. Tell us your ideas around what you feel is going to be beneficial down in the island.
I think it would be a great space, and how I envision it is really having these very necessary discussions with high level, the people that actually make decisions, about the types of healthcare that we receive. And it's really those people that I want to appeal to and have these conversations with and find out how we can go about receiving better healthcare and what is it that they think that is missing, what do they need, what kind of support do they need from us, in order to make this happen.
So important to have that, and we're looking to do that, and we're working with our one of our partners, Christopher Lafayette at Gatherverse. That's another project that we're going to be having. I think it's coming out in December because you are an author. I want you to talk about another one of your children of thought here around the book conference that's coming up.
Mhm. So we are the sponsors for the Gatherverse book conference that will be, or summit, that will be taking place. I believe it's the 9th of December. And we're really looking forward to it because we believe it's going to be probably one of the largest Gatherverse summits of its kind. So we're very excited about that. It's going to be a great place for authors to be able to showcase their work. As an author myself, I think of about 16 titles. I think that it's going to be a great place where you can come and learn as well, and how, and even from people like yourself who are also new to being authors at this level, and also what it takes to keep the book alive, have it on this journey, and I think it starts for, especially for new authors, this is a great place for you to sort of showcase your book to a whole network of people, not only within the industry, but readers alike, those within AI, and can you imagine all the types of books as well, and also about the language as well? I'm very particularly interested in speaking about how, the English language that kind of unites us all, how that was formed, and, and talk about as well, like the ancestry as well, of storytelling. That's really, really important as well. And why it's important for authors, and why it's important for publishers as well, which is what I do in my day-to-day life. So yeah,
I love
really
it,
looking
man.
forward to
Encourage the audience, go to gatherverse.org. You'll see a lot of the events that are coming up, and this is one
it.
of them. We also have my book that will be released very, very soon. There's a release to be released through Re Publications. You've been very, very good in helping me to develop this book. It's called First Light, and it's a brave framework to authentic leadership. Give us your take. What do you think about First Light?
Well, I think First Light fits very well with the brave framework that you have geniusly put together. And I think it really encapsulates what we've been doing in this series. I think I feel very brave, within myself on this, in taking this solo journey and speaking about the things that dearly matter to me. And I think that the Brave framework is a great tool and a very necessary one for leadership. So anyone who's wanting to sort of be the sort of pilot, in their field or in their industry, and wants to, take leadership to the next level, they need to really be involved in the Brave framework.
I love that. I love that. And we're going to have another series that's going to start very soon. It's going to be called First Light. And we're going to have a lot of people that help to, read the book. They have some of their thoughts around it. We're going to have, candid discussions for that. For you, I want you to understand what it is that I put together, because I feel it's more than a book. I feel that it's a guiding beacon for anyone who's really looking to rise above uncertainty and step into their full potential. And I've trademarked my Brave Blueprint strategy for individuals. And in it, I distill decades of my own experience, whether within leadership, branding, and into a clear, actionable framework for other people. And I am rooted deeply in resilience and in vision. So I want to help readers to break through these barriers, to reframe certain challenges and ignite new possibilities that are in business and in life. So if you're seeking executive, clarity, your next mission in career or business, this may be exactly what you need to get you to the next level. We'll also be having a masterclass that's going to help people that can pull it all together for everybody. So this has been wonderful. Any parting words before we take off?
Thank you, Grant, for this opportunity. I mean, it's led to so many other projects now that we're working on, and not just other projects. I mean, they're huge projects. I think I can only do sort of like don't think I can take on any more. Huge projects like this that we're currently doing. So I'm really grateful for the opportunity. I'm very thankful that I've been able to sort of speak about, my experiences within health. And it's been a wonderful experience and seeing how much I've grown within it as well. And even my own writing as well, as I've been writing my own Live Right series throughout this. So, I'm quite proud. So, thank you for the opportunity. Thank you for what you do. It's really important.
Oh, I appreciate you. Appreciate you. We are advancing women's health throughout the world. This has been wonderful, and I will meet with you again in First Light.